You've built your adjustable check socket, and panel locations have been confirmed. You and your patient have practiced with RevoFit and are now ready to make adjustability a way of life. It's time to make the definitive socket. This definitive build takes it up a notch and will challenge your RevoFit knowledge and skills. But you're ready for it. If you recall from the AK design video, you will have two dials controlling two areas of adjustability to maximize fit, comfort, and performance. It's definitely a more complicated design, but after you accomplish this build, you will be ready to expand your socket designs with creativity and confidence. So, let's begin by gathering our supplies. You will need sandpaper, superglue, 60-second composite adhesive, a razor blade, several colored wax pencils or chalk, a Sharpie, and 2 RevoFit kits, which will each include a dial base, a dial, tubing, lace, a T6 tool, and a wire lace feeder. During fabrication, keep your check socket nearby. You will reference it along the way for panel placement. Also, remember the RevoFit system works best with a flexible insert, so you will laminate over the insert you made for your check socket. Laminate your first layer over the insert as you normally would. Then prep the socket for a second lamination by sanding it. Draw your trim lines in one color, including the posterior cutout. We like to use chalk because you may need to erase and redraw your lines as you refine your design. Remember, the longer the cutout from top to bottom, the more proximal adjustability the patient will have. Reference your check socket and draw your panel locations. Use a ruler to accurately transfer your panel shape and size from your check socket to your definitive. Now, you've got 2 dials to locate, one on the lateral side to control the panels, and one on the medial side to control the posterior closure. These will be mounted distally, close to the mounting block. Once you figure out their location, mark the socket. Use the quarter rule to mark the panels and establish the pathway. It helps to use a different color of chalk to distinguish panel markings from your lacing pathway markings. Then, sketch the lines connecting the panels to each other. If the panels are at different heights, there will be a gentle turn somewhere on the frame. Avoid any sharp angles here to prevent the tubing from kinking. Now, sketch in the pathway from the lateral panel to the dial location near the mounting block. Even though the turn on the frame is tight, make it gentle. Next, sketch the lacing pathway that will cross the posterior cutout. On the lateral side, draw a small turnaround and route the pathway across the cutout to the medial side. It's important to note that the laces crossing the cutout must be perpendicular to the edges and not angled as is typical with most posterior straps. Then descend the pathway to the dial base on the distal end. Now, quickly double check your work. If your panel pathways are marked correctly, they will cross the panels parallel to each other and perpendicular to the edges. There will be one turnaround on the frame, and the pathway will hug together as it approaches the dial. Ensure that all turns are gently curved. If the posterior cutout pathway is marked correctly, there will be a small turnaround on the lateral side. It will cross the cutout perpendicular to the edge and will hug close together along the pathway as it approaches the dial on the medial side. With the panels and the pathway clearly marked, it's time to attach the RevoFit hardware. Mount each dial base by roughing up the bottom and securing it with 60-second adhesive. Make sure that the exit ports are lined up with the pathway before the adhesive sets. If you would like, you can cut the tabs on the bottom of the base, like we've done here. Now, lay the tubing down. Cut one end of the tube and pack it with clay before inserting it into the center of the silicone on the dial base. Secure the tubing with superglue every inch or so. Remember to ensure that there aren't any kinks in the tube. For the super tight turns, we like to heat the tubing slightly and use a dowel to guide the tubing around the turn. As you approach the reinsertion point, stop gluing about 10 centimeters from the base. Measure the length of tubing to the center of the dial base, cut the end, pack with clay, and insert it fully into the silicone. Now, go back and secure that length with superglue. Repeat this process for the posterior cutout pathway. Remember, if you get a kink in the tube, you must remove the entire length of tubing from the socket and start over. You can trim the kink and reapply the same tubing, but the tubing on the socket must be one continuous length of kink-free tubing. You cannot splice together two pieces of tubing on the socket. Now, with the dial bases and the tubing in place, backfill any gaps under the tube or dial base with 60-second adhesive. Any unfilled gaps will kink the tubing under vacuum. You do not need to secure the whole length with adhesive though. This should remain clear so that resin can pass under the tubing. Set up for final lamination by preparing more resin than you think you'll need. This will also probably take more time than you usually allot for. Be careful as you work the resin up the mold. Do not displace the tubing and the dial. Also, air and resin tend to collect around the base and the tubing, so make sure you work out any excess before the resin sets. Now, recreate your trim lines, trim, and remove the socket from the mold. Remove your insert and redraw your panels. Reference your check socket again for this. Also, you can use the quarter rule to locate the top and bottom of the panels in reference to your tubing lines. To do this, measure the distance between the tubing, divide that number in half, and that will be the distance from the top tube to the top of the panel, and from the bottom tube to the bottom of the panel. Now, cut the panels using a segmented cast saw blade. Grind the panels and frame edges, and clear any debris from the holes. All exit holes should be super smooth to prevent lace wear and tear. Then, use the grinder to expose the silicone on the dial base. Remove the silicone and continue grinding the edges of the socket to the top of the dial base. Be careful not to grind into the dial base itself. Finish smoothing the panels, lacing holes, frame edges, and dial base by hand sanding with 1000 grit sandpaper. Remember, any sharp edges can cause damage to the laces. Now, with a razor blade, trim the tube from the interior of the dial base and remove the ends, along with the clay. Make sure the tubing is clear of any debris. At this point, you will drill the pilot hole. The pilot hole allows you to access the release tab to remove the dial, if that becomes necessary at some point. Look for the 4 dots on the top edge of the dial base. These show you where to aim. Drill through the lamination on an angle into the area under the 4 dots until you hit the void. It'll be pretty obvious when you get there because the drill pressure stops. Next, attach the pads. Remember, the pads should be thick enough that the panels rest above the socket frame when the patient is wearing it. You likely determined the ideal pad thickness in the check socket phase, but now is an opportunity to refine and optimize that thickness based on what you found during the fitting session with your patient. Once you know the pad thickness, glue the pads to the panels and then trim the padding to size. Use the grinder to shape and skive the pads into a convex shape for optimal pressure in the socket. It is often the case that the padding on the panels are not thick enough to achieve a convex shape, as has happened here. In that case, glue on another layer of padding and use the grinder to skive to a convex shape. In preparation for lacing the system together, determine the correct orientation of the panels. Use the wire lacing tool to feed the lace through the socket. Once laced, pull the lace through, making sure it moves easily through the socket. Then measure 15 centimeters of tail on both ends and cut. Now, use the wire lacing tool to thread the lace into the dial. Go into the small hole of the dial and out of the corresponding large hole. Tightly tie a double overhand knot, trim, burn the edges, and pull the knot into the dial. Repeat with the other lace end. Insert the feet of the dial into the slots in the base and turn it a quarter turn to lock it into place. Cycle the system several times to ensure the lace is not caught anywhere in the system. Pull up on the dial to release the lock and pull the panels out. Re-engage the dial by pushing it down and twist to tighten. If the lace is caught for some reason, remove the dial and clear the snag. To do this, either insert the T6 into the pilot hole to push on the release tab while twisting the dial clockwise, or use pliers to squeeze the base of the dial, again putting pressure on the release tab, and turn the dial clockwise to remove it. Once the snag is cleared, reinsert the dial and cycle the system again. Your AK socket is now complete. All that's left is to tune and deliver it to your patient. You should be proud of what you've accomplished. Building RevoFit sockets is a learning process, but it's a bit like riding a bike. Once you get the hang of it, it becomes easy. So keep practicing because the advantages of long-term adjustability are hard to overstate. Adjustability will change the lives of your patients who will approach each day with greater confidence, ease, and freedom than they've ever had before. Problems donning and doffing will be eliminated, and sockets that are too tight to be comfortable or too loose to be secure will be a thing of the past. Your patients will simply adjust their socket to their changing bodies and to the changes in their lives. Adjustability will change your life too. Delivering sockets with an ever-adjusting range of fit means your patients will fix their own fit issues. That means fewer office visits, fewer socket remakes, and happier patients. What would that mean to you and your practice? More free time, more billable events, a better reputation? Adjustability delivers all of these and more. Welcome to the world of adjustability. We're glad you're here.